Hey guys, Woodruff here. So along with trying to add some practice questions in, I figured to also incorporate some short scenarios sometimes that might be helpful for you. So these are some respiratory scenarios that I've created. So hopefully they can help you to get into this information in a new way. Like I mentioned in some of my test taking strategy videos, like practice questions are great, but open-ended questions are great too, and looking at situations, because really that's what you're tested over. So this first scenario, this is a respiratory scenario. And again, even if you're not studying this topic right now, you can use some of the ways that I approach this strategy to study whatever you need to be studying. So in this situation, Greg, it's a 50-year-old male. In the past medical history, he has BPH, which if you don't know, that's benign prostatic hyperplasia and hypertension. He ate at a new restaurant, and after ingesting some food, he began to have trouble talking, and breathing. His tongue, mouth, and face are swollen, and he is unable to communicate. His oxygen saturation is 80% on 2 liters. So there's a lot of information in this question. So his past medical history might be important, but right now, the first thing I always like to do when I look at a situation, so especially if this is a test question, case study, you're taking the NCLEX and I give you one of those long, situations, first thing you want to do is this patient stable or not? So based on this, do you guys think they're stable? The answer should probably be no. Their oxygen saturation is only 80%. Their airway is swelling. Like this could be an emergency because they could stop breathing or stop having a patent airway. So this is an emergency. And so you always want to think about that. Like anytime you're given a test question or things, am I looking at something that's just an everyday situation, or is this something life or death? Because it's going to change how you're going to respond. Like, are you looking at what you need to do priority, or are you just looking at how you can improve someone's quality of life? So the first question that it asked me for this scenario is what cues in the story that are able to help you determine what's going on? So what are the most, so that's asking you to take out what is the most important things. So this is a great thing to practice just when you're practicing reading, especially if English isn't your English isn't your first language. And if you struggle sometimes to piece apart what's important, practicing looking at what's important is super helpful when you're doing practice questions, case studies. So like the cues for me is he ate at a new restaurant. So it's something that's maybe new or different for him. After ingesting food, he started having trouble. And he's the other things that I'm looking for is what his problem is. He's having trouble talking, trouble breathing. He's having swelling in his airway. He can't communicate, and his oxygen saturation is low. So like, a lot of that stuff to me, it's starting to tell me he's reacting to something that happened. He ate and then he reacted, like his body reacted or maybe overreacted to something. So those are some of my cues. So I want to think about, if I was studying this section, what is this most consistent with? And that's the next question. What do we expect is going on? So what do we know is a condition that leads you to have swelling in your airway, that is related to ingesting certain substances, as one of the possibilities, and can affect your airway breathing. And if you're thinking what I'm thinking, you're thinking anaphylaxis. So 100%, this is what anaphylaxis looks like. Now, he ingested new food, but it could be from a lot of different things. Other people, sometimes it's scents or things out in the environment that they react to, but effectively his body is overreacting and saying there's an invader here, and trying to get rid of that. How will we treat it? So there is a, a lot of times if you're anything like me, where I would always get in my head, like thinking like, oh, what do I need to do first? I'm like, well, am I still in the restaurant or what's going on? This is like, we're imagining we're still in the hospital now. Like, what are we going to do? Like, just in general, what are we going to do to treat anaphylaxis? So we want to think first. I always remember for anaphylaxis, you want to think the A in anaphylaxis mean I have to take care of my airway first. So this guy, his oxygen's low. So some students would maybe, if there was a multiple choice question here, they would maybe choose apply oxygen. And while he definitely needs more oxygen, think of this like trying to get water out of a hose that's kinked. You can't get the water cannot flow while the tube is kinked. So same with the airway. If my airway is swelling, closing up, if the person is not able to talk well or communicate with you, it's really a big sign that their airway's not open. So first thing I need to do is open their airway, and then I can get that oxygen in. So what do we do to open a patient's airway? So if you're an ICU nurse like me, I know you want to say, put a tube in them, and that's probably true. We probably will end up intubating this patient, but first and foremost, there's the number one top first treatment for anaphylaxis is epinephrine. So yes, so epinephrine is usually one of the first things we're going to do. And then there's a host of treatments. We want to do things to decrease swelling. So stuff like steroids. I'm talking about inhaled steroids. They might need IV steroids too. We want to do things to open the airway like bronchodilators. They may get some stuff like IV Benadryl, help to decrease that allergic reaction. Everything we're giving, you notice it's inhaled or it's intravenous because we do not want them swallowing anything. So always keep in mind, sometimes it's a little tricky on test questions. Make sure you're looking at the route you're giving those meds. If it said PO Benadryl, that's a tricky one, but we need to give it something intravenous. And then how will we know they're getting aside from that, epinephrine, steroids, bronchodilators, the IV Benadryl, oxygen therapy, and then they might need IV fluids if their blood pressure is low. So things like that will be helpful. Those are some mainstay treatments. And how will we know they're getting better or worse? So if you ever struggle with this, how do we know we're getting better or worse? Think of what problems you have and how those would look better. So if their tongue, mouth, and face are swollen, they're unable to communicate, and their oxygen saturation is low, what would I hope to get better? Well, I'd hope that they start being able to communicate, or at least being able to keep a patent airway or show signs of being able to keep a patent airway. I would hope swelling would decrease, and I would hope that their oxygen saturation would increase. So yeah, it's going to be things like that. This patient is at risk for going into shock, so we just always want to keep an eye on that too and make sure that they're not showing any signs of deterioration when it comes to their blood pressure and other stuff like that too. So this is just one way, but you see how much that we got just from doing one scenario. So this is a great way to kind of test your knowledge or see where you're at with some topics. We'll see which ones we have coming up next. Hope you enjoyed this. See you later.